Hey guys, what's up? So in this video, we are going to talk about Pharm for primary hemostasis, so our platelet inhibitors. And right here, if you have not watched the past video that I did on the physio, as well as the two pathologies that are highly intertwined with primary hemostasis, I encourage you to go check those out. I want you to keep in mind that with our Pharm, we're essentially inhibiting some of these actions from the physiology, right? So the first category of drugs that I want to talk about are the drugs that inhibit the ADP receptor, aka the P2Y12 receptor. Sometimes they're called ADP receptor blockers or antagonists, but I've also seen them called the P2Y12 receptor inhibitors because, as you can see here, the P2Y12 receptor and the ADP receptor, it's the same thing, right? So this is this category of drugs. They're also called thienopyridines as a category of drugs, okay? And the way that I remember all of their names is by a country singer from like the 1960s. Her name was Patsy Cline. And I remember Patsy Cline takes ticlopidine. And in remembering this little saying here, I only have to remember three of their names. So the P is prasugrel. The C here is the one I know that you've heard of it, clopidogrel. Takes is ticagrelor, and ticlopidine is itself, ticlopidine. Now, these medications again inhibit the P2Y12 receptor, aka the ADP receptor, and they are oftentimes used to reduce the risk of thrombotic stroke. They're also used post-stent surgery. Right, clopidogrel now is one of the standards with angina. Oftentimes, cardiologists will go ahead and put patients on clopidogrel, for unstable angina, okay, acute coronary syndrome, and anytime just post-MI, okay. An ADP receptor blocker is the standard with aspirin, of course. Some side effects here that we really want to make sure that we remember: clopidogrel and ticlopidine. Clopidogrel can cause TTP, thrombotic thrombocytopenic purpura. Ticlopidine can also cause TTP, as well as neutropenia. All right, so now on to our next category of drugs. And in our last video, we talked about Glanzmann thrombasthenia, as well as ITP having this problem, I guess, with the GP2B3A receptor, right? So with Glanzmann, the patient is born without it because it's inherited, it's autosomal recessive, and with ITP, they develop IgG antibodies against the GP2B3A receptor. So there are drugs that actually inhibit GP2B3A, and they're called GP2B3A receptor inhibitors. Now, I always ask students, do you like to eat or do you like to drink tea more? And 80% of students say eat, so we'll go with that, E-A-T. The first one is eptifibatide. A is abciximab, and the T is tirofiban. Okay, now remember, abciximab, it ends with a mab. It is a monoclonal antibody. Okay, and these drugs are used in acute coronary syndromes, as well as whenever a patient is undergoing a percutaneous transluminal coronary angioplasty. Okay, and some side effects from those drugs are bleeding. Of course, all of these drugs can cause bleeding, as well as thrombocytopenia. All right, now the next category of drugs that I really would like to discuss are our PDE3 inhibitors. I'm going to put those right here. Phosphodiesterase 3 inhibitors. And always remember PDE for DC, right? As if we're campaigning. DC. D is dipyrimidol and C is cilostazol. Okay, now the way that these work, right, they increase CAMP or cyclic AMP in platelets and thus decrease aggregation. They cause direct arterial vasodilation, which makes sense whenever you think about their uses, right? They're used, particularly cilostazol is used for intermittent claudication. Okay, it's also used for angina, can be, but honestly, this is the big thing that I see cilostazol used for. Dipyrimidol can also be used for a chemical cardiovascular stress test in patients that can't exercise. Okay, that I oftentimes see. Keep in mind that because these do cause arterial vasodilation, a huge side effect with these other than GI upset, etc., which is never tested on really because all drugs cause GI upset, big side effect here is going to be hypotension. All right. Now the last category of drugs that I want to discuss is aspirin. Yes, aspirin. That medication that you can buy over the counter, aspirin, okay? So aspirin essentially irreversibly inhibits COX-1 and COX-2, but mostly COX-1. And as a result, it will inhibit arachidonic acid converting to thromboxane A2. And if you look right up here, if we inhibit thromboxane A2, right, we inhibit the sequestration of more platelets, and we also inhibit the full activation of platelets. Handwriting's getting a little sloppy, guys. All right. Remember that with this medication, we will see an increase in bleeding time with no change in PT or PTT. Okay. Now, aspirin is used to prevent MI. Okay. It's used as an analgesic, antipyretic. Okay. It is used to prevent clotting, like stroke in atrial arrhythmias, like AFib. Okay. Oftentimes they'll be put on a 10A inhibitor as well as aspirin, but aspirin is certainly can be used depending upon the physician and the patient's situation. It could be used as a standalone. Okay, and also keep in mind that low dose can prevent colon cancer. So, side effects of aspirin, super duper high yield here. Side effects, I want you to keep this in mind. GI bleed. Okay, Ray's syndrome. This is why we don't give aspirin to children under the age of 7 unless they have Kawasaki's disease, because in Kawasaki's disease, the benefit would outweigh the risk. But Ray's syndrome is a side effect seen particularly in children, so remember that. Hyperventilation is another side effect. Again, because it's so acidotic, the patient may begin to hyperventilate to try to blow off some of their CO2 to balance out that metabolic acidosis with a respiratory alkalosis. Then we also have tinnitus, right, which it can affect cranial nerve 8, yes, vestibulocochlear, right? It can cause synchronism, tinnitus, thrombocytopenia, and hearing loss, okay? And it can cause aspirin-induced asthma. Now, are there like 50 billion other side effects of every medication? Yes, but these are the side effects that I have seen on UWorld, on pretty much all of my Q banks, going through steps 1, 2, and 3, and now studying for my internal medicine boards with MixApp. These side effects are long lasting, so you're going to see these for many years, especially if you're studying for step 1. You're going to see these on so many different exams in your future. I hope that this has been helpful. If you like it, found it helpful, click like and subscribe. Thanks.